Hi, my name is Ricardo Pimentel. I'm the editorial page editor of the Milwaukee Journal-Sentinel, and today we have Mayor Tom Barrett, who is a Democratic candidate for governor. And we're going to do an interview with him, he and the editorial board, and this is part of a process we have in determining who we recommend in our races. So welcome, Mayor.
Thank you very much. It's nice to be here.
Well, we're going to jump right into questions. And we'll get to this first. You have released a plan in which you get $200 million in savings from, if we get this right, encouraging parents to choose lower cost health plans in state programs. But since the feds pick up part of our costs, we've read where the state would actually need $500 million in savings to hit your goals, and that you have to cut spending in the program by nearly 40%. Are these figures right? How would you get your state savings generally?
Well, this is part of my plan to put Madison and state government on a diet. And what I was attempting to do, and what I think we've been successful in doing, is laying out a wide range of options for the state to save money. And I did this because it's very clear to anybody who looks at the situation in Madison that with a $2.7 billion structural deficit, and I use that figure because, according to the Fiscal Bureau, it's $2.5 billion. And then with the Supreme Court's decision pertaining to the Patients' Compensation Fund, that's another $200 million plus interest. That you're at $2.7 billion. So this is one of the recommendations, and we believe that by putting forth a plan where we save really more than this money in health insurance costs throughout the state, that we're going to be able to start chipping away at that. The aggregate figure that we have in our putting Madison on a diet plan is $1.1 billion. And we do believe that we'll be able to achieve those savings, that we'll be able to persuade families to go to a plan that really provides the health coverage that they need, but at the same time allows us to go to lower priced options.
Does that involve charging them premium?
No, not necessarily. It's going to the most efficient plan, and we do think not only in this area but in the area of, for example, aggregating local employees with state employees, we'll be able to achieve some economies of scale. And what I mean by that is one of the big challenges I think right now when it comes to health insurance is that you have fewer and fewer providers. Both in the insurance field and in the actual delivery of healthcare system. And so when you've got fewer suppliers, they have greater and greater market strength in a relative sense. And I think a market solution to this, and I stress the word market solution, is to allow on the demand side to have more market strength, or to put it in a more colloquial way. If you're fighting an 800-pound gorilla, the best way to fight an 800-pound gorilla is to get your own 800-pound gorilla. And so whether it's the state plus local governments, we need to find ways to bring down those costs. And I think through a market-driven solution, that's the way to do it. And I think it's no surprise to anybody in this room, this remains a very hot issue. As the mayor of Milwaukee, this year we will see a $25 million increase in our health care costs, 21% increase just this year. So it is a hot issue for local governments. It's a hot issue for the state government. And we're going to do everything we can to try to achieve efficiencies, but also to get more leverage in the market.
The governor developed a plan where childless adults get covered and more Wisconsin children get covered under Badger Care Plus. Was that the right thing to do?
Well, I'm a big fan of the Badger Care program. In fact, when I was in getting the waiver that allowed this to occur, just as President Bush was taking office and as President Clinton was leaving office, it was one of the last waivers that was granted actually under President Clinton's administration. So I am a big fan of the Badger Care program. Certainly for children, I think the more children we can have covered, the better off we are. I think what happened with childless adults is that's where we've run into some long waiting lists. And that's what led to this new plan, the Badger Core plan,
which I don't think has taken off to the extent that the
Had to be capped.
that the drafters want to. But no, then the plan even after that. Now there's another plan beyond that
Okay.
where you'd pay $130 a month for adults, and the demand hasn't been there. I think given this economic situation or the fiscal situation that the state is facing, I'm going to do everything I can to maintain what we currently have. And I think that's got to be the first order of business before we look at any expansions or anything like that, is how do we maintain it? But if it comes to the point that we can't maintain everything, my priority is going to be to maintain those programs that serve children.
Okay. You think those savings, though, are real? That you,
I do.
You
Yes, I do.
project? Okay.